You are listening to You Restored with Dr. Kelley Reis. To listen to all episodes, visit libertynaturalwellness.com. I want to start today off by telling you a story about me. So in my 20s, I started going through a period where I would get racing heart, palms sweating, very agitated, and it grew into full-blown panic attacks. I'm talking like absolute fear, not knowing what I was afraid of, thinking crazy thoughts like family was going to be killed in the middle of the night. It was absolutely crazy. Now, the reason I'm telling you this is because there's a lot of reasons one can feel that way. Now, mine was I was drinking a pot of coffee a day. Yeah, a pot of coffee a day. And when I realized that, I stopped the coffee and the panic went away. The anxiety, however, was kind of this undercurrent still happening, but the panic went away. So, panic attacks are kind of the culmination of an anxious moment in some, not everybody, but if you've had a panic attack, you know exactly what I'm talking about. You want to run away, but you don't know where you want to run away to, or you don't know what you're running from. So, but that panic is absolutely real and needs to be assessed. Now, I've always, I tend to be more of an anxious person. I really can say I don't believe I've ever been depressed a day in my life, but anxiety is a whole different ballgame for me. And it's something that I've always had to keep tabs on. And I work with so many people with what they are diagnosed with as anxiety. The most important thing here, guys, is that we have to figure out the why. Just like I was talking about with depression, you walk in, you say you're anxious, what is handed to you but a prescription? And it's usually now for an SSRI like they give in depression. I went through all of the side effects of SSRIs and how, the whole serotonin idea. Well, serotonin's not the biggest player in anxiety, but they give SSRIs because benzodiazepines like Valium or Xanax, They come with a lot of side effects, very controlled substances, very addictive because they work. So, when you walk into a doctor's office and all of a sudden you're handed a script because you tell them that, you have these moments or you're full of worry, we have to get to the bottom line and understand more why. A very common patient that I have is someone, I'm just going to talk about one in particular because I see this a lot. So she comes in, she has these moments of anxiety, and anxiety is real. It's a symptom, however, but anxiety is real. She has these moments of anxiety, but they are like 3:00 in the afternoon, 2-3 hours after she had a carby lunch, or 3:00 in the morning and, full blown sweating, sweaty palms, heart racing, like almost can't catch your breath. So I ran a GITT. That is a glucose insulin tolerance test. And the reason I ran this is because of lining up the timing of her symptoms. And lo and behold, that insulin, so glucose insulin tolerance test is a 3 to 4 hour test where the glucose and insulin, blood glucose and insulin, are taken prior to drinking a sugary drink. And then glucose and insulin are timed and redrawn every 30 minutes to see what happens. And she was suffering with what is called reactive hypoglycemia. So her glucose would rise, and then along with her glucose, her insulin would overshoot the peak of glucose. So the insulin it was reactive. So it was dragging her blood sugar down. She was having blood sugar crashes. Do you know that managing her blood sugar and getting her eating the right things at the right time and, managing a few other things, her anxiety symptoms went away completely. And it was blood sugar / insulin reactivity. So it is absolutely crucial to look into this more deeply. Everything. Guys, like why, not what. We need to look for the why, not just treat the what with medication or supplements. So it matters a lot because there are so many different reasons one could feel anxious. First one, besides blood sugar, which I just talked about, blood sugar is a huge one. But another one that I see a lot is adrenal gland, stress response, hypothalamus pituitary adrenal axis, HPA axis. And this is perceived threat. And I've talked about sympathetic dominance, all of that. You know my story and my thought process on sympathetic dominance. But cortisol, the stress hormone, is a real factor. If there's a perceived stress, it is going to rush sugar into the blood because you've got to run, fight, something, fight or flight. So you can have these dramatic increases and dramatic decreases in blood sugar due to stress, but you can also have spikes in cortisol that mimic anxiety. So your body, in a fight or flight moment, what happens? Heart races, hands sweat, and you're not anxious. This is a stress response. So the stress response can mimic anxiety. And like I said, anxiety is a symptom. I know it has a mental health diagnosis, but it's a symptom. We just need to figure out why, where, how. The other place I see anxiety show up is thyroid. Now, a lot of people are medicated improperly on thyroid. Usually it is the NP armor thyroid that have a little bit of T3, the active thyroid hormone, which I've talked about before. And T3, if that runs too high, boy, anxiety is one of the top symptoms. I always ask my clients if they're on Armour or NP thyroid or liothyronine, which is the conventional non-natural version of T3. If they are on that and they're feeling over-caffeinated or a little amped, that is likely, not always, we test, that is likely over medication, hyperthyroid. Some people just run hyperthyroid, and anxiety is absolutely a real symptom in hyperthyroid. Now, I've seen some people compensate, like with Hashimoto's autoimmune thyroid. I've seen some people compensate. Their body's they're tired, they're fatigued, they're drained, but wired as well. So wired and tired and feeling anxious and having real anxiety symptoms. I mean, can have full-on panic attack. And that is because their body's trying to overcompensate for being so low. So a low thyroid as well as a high thyroid can lead to symptoms of anxiety. Now, another one that's come up a lot more, you've probably seen it around, you've seen and heard me talk about it, is histamine reactivity or overabundance of histamine. We're seeing a lot more post 2020 that mast cells, the cells that release histamine, are a little overactive. Now, histamine can definitely interact with the nervous system. Absolutely 100%, especially if you have leaky gut. So histamine can trigger amped responses and amped feeling. And here, this is a mast cell / immune system issue that is causing symptoms of anxiety. The histamine response, mast cell activation syndrome, it's a little harder to test. It can be, there are things that can be tested, but a lot of times people don't feel amped all the time. It's a moment when they have these kind of periods of amped feeling. So mast cell activation syndrome, histamine overabundance, very, very possible to have symptoms of anxiety. Now, I mentioned leaky gut. The gut and the nervous system are intimately linked, and that is through the vagus nerve. The vagus nerve, so if you have leaky gut and pieces of bacteria, lipopolysaccharides, or other things that aren't broken down properly and leave the gut and they get into the bloodstream and they're interacting with the nervous system, like they are like this. And they are now all of a sudden your nervous system, your immune system, all of them start getting a little nervous themselves about what is this thing that we're not supposed to see because it wasn't broken down. It's not supposed to get through that barrier of the gut. So leaky gut has a very big / direct impact on anxiety, the feelings of anxiety, the symptoms of anxiety. So there are so many, 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 many reasons one can feel anxious, all the way up to panic attacks. I do not wish a panic attack on anyone. It is the most irrational fear that you can't talk yourself out of. It comes in waves. And honestly, how I felt that it worked the best for me before I understood that it was caffeine as a major driver, that they come in waves. And if you try to fight that wave, it's coming no matter what. And I was never able to stop an impending panic attack ever. What I found though, if I kind of stopped fighting it and let the wave come, the wave was lower. When I fought it, the waves were much bigger, and they kind of like, it's a bigger wave and then a smaller wave, then a smaller wave, then a smaller wave. They're rough. And, you know, the medications out there for anxiety, as I said, they prescribe SSRIs. There's already a big problem how SSRIs actively change brain chemistry, actively. And years and years and years for some people to kind of reprogram or get their brains back to what I'm going to call normal. So SSRIs have only been given in the more recent years because doctors don't want to prescribe the benzodiazepines. There are so many side effects with benzodiazepines beyond addiction. Heart events. You know what one of the biggest side effects is of a benzodiazepine for some people? Anxiety. I mean, they work within, usually 30 minutes, where SSRIs can take 4 to 6 weeks if they're even going to help. But benzos, they work quick. And that's why they're so addictive, because they do bring that moment down and people, I don't want to call it relax, but they're almost kind of checked out. But there's so many side effects that, withdrawal symptoms, seizures. They're finding major cardiovascular events to be higher potential in women in particular, women on benzodiazepines. The bottom line here is that anxiety is a symptom. It's the other side of the coin of depression, as far as I'm concerned. Anxiety, we're not in the present. We're always one step ahead. Really common for women with sympathetic dominance. And so always being one step ahead, that worry, that I urge you to assess yourself and journal. When am I most anxious? Am I living in the moment, or am I, 2 weeks ahead, even a day ahead, that I'm not present? I am worried about what could happen. I urge you to journal. I urge you to journal food alongside these anxiety symptoms, any gut symptoms you may have. Are you on thyroid medication? Is it being tested properly? Is your thyroid being tested properly? If you are on a T3 supplement or medication like the Armour MP Thyroid liothyronine, it's very important to get your thyroid blood test 4 to 6 hours after you take it in the morning. Rare to hear a practitioner tell you to get your blood drawn at that time. That gives us, how high does your T3 get from that medication? I see so many people over-medicated all the time. It's a fairly simple fix as well. So get the right testing. Really, you need to be responsible for assessing your symptoms and the timing and how your anxiety symptoms might be different from the next person. Those are all clues into better understanding why you have that symptom. This is Dr. Kelley, and this is You Restored.